Hi, through this video we will be seeing next generation NCLEX-RN type questions, their answers with explanation. The first question is, the nurse implements SBAR to promote effectiveness in which quality and safety in patient care? So the nurse has implemented something. So what is that? That is SBAR. So what is this SBAR? You need to know. With this SBAR, the nurse is trying to get some quality in patient care. So what does this SBAR you need to know? The options are surveillance, communication, organization, and cost effectiveness. Let me go to the answer first. SBAR is related to communication. So when a nurse implements SBAR, that is something which is related to the communication. SBAR, it is particularly used in high risk situation. When the nurse feel like the patient is at risk, at that time to communicate, the nurse has to use this SBAR. SBAR is actually an acronym. So it is for first S stands for situation. So the nurse has to tell a brief statement of the problem or the issue that is being faced there. So first S is the situation. Second one, background. What are the data which is related to the current problem? The background history the nurse has to describe. The third one is the assessment. What may be the causes? What are the importance? What is the severity of the situation? Everything the nurse has to assess. When a problem is there, you have to understand the background, then you need to assess what is the situation. And last, the nurse has to tell some recommendation also. Recommendation in the sense, what is the specific action which is needed at this particular situation. Let's see this with the example. The situation here is, the nurse is calling a doctor. Hello, Dr. Tom. This is RN Linda, caring for Mr. William in room 104. I am contacting you because patient arrived to room from post-anesthesia care unit and has not voided in more than 6 hours. So this is the problem. The patient has arrived from post-anesthesia care unit and the patient has not voided since the last 6 hours. So the patient has a big problem. The patient is at risk. Next, the nurse needs to tell the background to the doctor. Because the doctor will be seeing a number of patients, the doctor might be forgetting something or the other about the patient. So to tell about the particular patient, some background history need to be told. Patient was admitted today morning and you performed a lumbar laminectomy this morning for a herniated disc at L4 and L5. So that is the background. Third one is the assessment. Mr. William was complaining of inability to void. So this is the first thing the nurse has assessed, that is the subjective data which she got. He received 1500 ml of IV fluid during the anesthesia, during the procedure and also in the post-anesthesia care unit. So the patient had received 1500 ml of IV fluid. This is obtained from the records. Indwelling catheter was removed prior to transfer from post-anesthesia care unit 6 hours ago. So the catheter also was removed in the anesthesia care unit. At that time, urine output was 800 ml. When catheter was removed, at the time urine output was 800 ml. After arriving in the room, patient has again received 200 ml of IV fluids. So the intake is there, but the patient don't have an output since the last 6 hours. This is what the assessment which is done by the nurse. Here, the nurse should not stop by the assessment part. Being an RN, the nurse should be able to have some recommendations with her. So this is the last part of SBAR, the recommendation. I recommend an intermittent catheterization can be performed at this time. So this is the recommendation which the nurse has given in the communication process. Situation she has explained, the background, the assessment, and last the nurse has to tell the recommendation also. This is what is expected from a registered nurse. Hope you understood SBAR. Thank you.